Okay, welcome back. Hello, my dear students. In this session, we'll discuss about a stroke or a cerebrovascular accident, which is one of the commonest neurologic pathology that we'll see in the next few slides. This stroke part, we will see by three parts. We classify it into three parts, and this one is part one lecture. Uh, Now, let us continue with the first part of the lecture series. So, our objective of this lecture is uh, you will understand after we discuss this session, you will understand the definition and the types of stroke, definition and the type of stroke, you will understand it, and you will learn about the risk factors and the important pathophysiologic mechanisms that may help you in managing your patient, and you will recognize about the clinical features and the management of a stroke. And finally, we'll have a review of case studies, and we'll see the outcomes of the patient at the end of the session. So let us start with the first part of this lecture. Now, the definition of stroke, the current definition of stroke is it is stroke, or in other terms, cerebrovascular accident, is defined as an abrupt onset of a neurologic deficit that is attributable to a vascular cause. So you classify stroke as ischemic stroke, which accounts for about 85% of all stroke cases, and the second one is hemorrhagic stroke, which accounts around 15% of the cases. So you classify stroke into ischemic and hemorrhagic stroke based on its mechanism. So global and the regional burden of stroke, when you see the burden of stroke worldwide, it is the leading cause of death, the second the second leading cause of death and disability globally. In fact, cardiovascular disease is the most common cause of death worldwide. So, as you know, this stroke or cerebrovascular accident is one of type of the cardiovascular disease. So, it is one of the leading causes of death and disability worldwide. So its prevalence is currently very increasing in low and middle income countries because of change in the living conditions of the developing and middle income countries, change in economy, and unusual sedentary way of lives, and most of the people don't have awareness about the prevention mechanisms of cardiovascular disease. So that's why the prevalence of stroke is increasing in low and middle income countries currently. So uh, when you see the risk factors of a stroke, whether it is hemorrhagic or ischemic stroke, you classify the risk factors of stroke as uh, modifiable and non-modifiable risk factors. So these are the mentioned below on this slide. You see the non-modifiable risk factors. You can take the age of the patient. You cannot modify the age, gender, family history of stroke or other cardiovascular disease, and race or ethnicity, and previous history of stroke or transient ischemic attack. The abbreviation TIA means transient ischemic attack. So these are the non-modifiable risk factors of stroke. If once they are available on a patient, they cannot be changed. They cannot be changed. So they are non-modifiable risk factors. The modifiable risk factors are those factors which can be modified, which those factors which can be uh, decreased. The risk can be decreased. The risk can be even sometimes you can avoid. You can avoid. So the modifiable risk factors like hypertension, you can modify hypertension by strict control of blood pressure. You can improve lifestyle of the patient and diabetes melts. So strict control of hypertension, strict control of blood glucose level, and by ceasing of smoking. If the patient is a smoker, if he or she discontinues smoking, that his risk decreases for developing stroke. And the other modifiable risk factor is dyslipidemia, atrial fibrillation, obesity, and sedentary lifestyle. These all are modifiable risk factors because if someone has sedentary lifestyle, you can teach someone to have physical exercise so that he can he can decrease his cardiovascular risk. The same thing is true for dyslipidemia, atrial fibrillation, and as well for obesity. So when you see the mechanism for ischemic stroke, it is caused by interruption of blood flow due to the thrombosis or embolism, or it could be systemic hypoperfusion. So ischemic stroke occur either due to thrombosis or embolism in certain vessel areas of the brain, or it could be due to the whole systemic hypoperfusion. It results from vascular occlusion secondary to thromboembolic diseases. So thromboembolic disease and uh, thrombosis are the most common mechanisms for ischemic stroke. So for hemorrhagic stroke, the mechanism is just it is bleeding into the brain parenchyma. It is parenchymal bleeding, intracerebral bleeding, or it could be sometimes bleeding into the subarachnoid space, which usually due to hypertension or aneurysmal rupture. So, uh, as you know, most of the time, if there is subarachnoid bleeding, subarachnoid space bleeding, that could be most likely aneurysmal rupture. It could be also due to hypertension. So, in general, hemorrhagic stroke mechanism is just it is a bleeding in the parenchyma of the brain. So with this, let's see the cerebral circulation basics. As we know, the brain has many arteries that arise from internal carotid artery and as well from the posterior part there is basilar and vertebral arteries. So when you see the anterior circulation, it involves the internal carotid artery, which bifurcates again into the anterior cerebral artery and the middle cerebral artery. So the anterior circulation involves it includes the anterior cerebral artery and the middle cerebral artery. Both of them are the branches of internal carotid artery. And the second circulation in the brain is the posterior circulation, which includes the vertebral arteries, the basilar artery, and the posterior cerebral artery. The posterior cerebral artery. So with this, you can see this picture. From this picture, you can see that the yellow part, this one is parts of the brain which is supplied by the anterior cerebral artery. This is the yellow part you see is the parts of the brain which are supplied by the anterior cerebral artery, and the blue part you see here parts of the brain which are supplied by the posterior cerebral artery, and the middle one which is colored by red, this red part is the middle cerebral artery territory. So this is the middle cerebral arterial territory that supplies parts of the brain. So as you see from this image, the anterior cerebral artery, the posterior cerebral artery territory, and the middle cerebral artery territory. Because anatomic location is very important for management of the patient. So you have to know which part of the brain is affected by the stroke. So this is all about the first part of this lecture. We will see part two in the next session. Thank you very much.